Okay, good afternoon, all of you, my dear students. Today we are going to discuss about the suboccipital region. In the last class, already Madam discussed about the what are the muscles of the back in detail, I think. And today we are going to discuss about the suboccipital region. What is suboccipital region, and what are the muscles in the suboccipital region, and what is its importance, and what are the bones that are taking part in the formation of the suboccipital region, and what is suboccipital triangle, and what are the contents of the suboccipital triangle, and what is importance. All these things we are going to see. First, you see, these are all the things we are going to discuss. And you see here, because osteology not yet completed for us, because of this reason, I want to give brief points regarding the that is back of the skull. That is nothing but the norma occipitalis. Here you see, this is the occipital bone, and it contains different parts. This is the squamous part, this is the mastoid part, and there is another part that is in the front, in the back, that is called basilar part. And here, for today's class, this occipital bone, especially the squamous part, is important. Here, before knowing about the suboccipital region, suboccipital triangle, you're supposed to know the some points related to the this bone. Here, this is called external occipital protuberance. External occipital protuberance. And here from this external occipital protuberance, on both sides of this one, there are lines. Okay, these lines, this is the superior nuchal line. And above that, there is another line, that is the highest nuchal line. And below that, from the external occipital protuberance up to the posterior margin of the foramen magnum, here there is a one bony ridge. This is called external occipital crest. External occipital crest. This is the external occipital protuberance. This is the superior nuchal line, and this is the highest nuchal line. And the middle point of this external occipital protuberance and the posterior occipital, that is a posterior margin of the foramen magnum, there is another line. This is called inferior occipital line, inferior nuchal line, not sorry, inferior nuchal line. Okay, these are all the different parts. And on both sides of this squamous part of the occipital bone, there are two bones, two more parts. That is this is part is called mastoid part of the occipital bone, and these are the two mastoid processes. And next, coming to the just below this occipital bone, there are cervical vertebrae. In cervical vertebra, there are about 7 cervical vertebrae. Out of this, first and second and seventh are atypical, and remaining are typical. Out of this 3 atypical vertebrae, that is first one is called atlas, and second one is called axis. Okay, and next, why it is called atlas? Here, because you see the Greek mythology, that is Atlas is a person who bears the total weight of the globe. Like that, this Atlas bone, it bears the total weight of the skull. That is why it is called Atlas. Okay. And next bone is the axis. This is the another bone. This is the axis. Why it is called axis is, that is because it acts like a axis to the atlas to rotate during rotation of the head like this. Okay, this is the movement of no. This is the movement of no. During this movement, it produces axis for the, here exactly this is the relation between the axis and the anterior ramus of, or arch of the atlas. Okay, because of this reason, this is called axis. Okay, these are the two most important bones. They are forming floor of the suboccipital region. That is why I'm explaining. Here, this is first you see about the axis bone. Here, this is the superior articular facet. It articulates with the condyles of the occipital bone in the base of the skull, and on both sides of these are the two foramina. They are called foramina transversarium or transverse foramen. Transverse foramen, it provides passage for the vertebral artery, and anterior to this one, this is the anterior arch of the atlas, and posterior to this is the posterior arch of atlas, and here the small elevation, this is called posterior tubercle of the atlas. Posterior tubercle of the atlas. On both sides of this one, there are two processes. They are called transverse process of the atlas. Like that, here also this is the superior articular facets. These are the transverse process. This is the spine, and here the spine of the axis is bifid. Okay, that is the specialty. And in the anterior arch, there is a one bony elevation. This is called odontoid process, or it is also called dens. Odontoid process or dens. Actually, this is nothing but the modified or a detached part of the body of the axis. Body of the axis. Because of this reason, there is no body in the axis. Sorry, atlas. There is no body in the atlas, and this is the body of the atlas. Okay, these are the parts present in the two vertebrae. Next, you see in between these three bones, that is basilar part of the occiput and atlas and axis, there are two joints. That is, this one is the atlanto-occipital joint, and this is the atlanto-axial joints. These two joints are most important because these are the joints responsible for the production of movements, that is in between the head and neck. That is, suppose if you want to move like this is called movement of S. This is between the axis and atlas. Okay, this movement is produced between the axis and atlas, and this is called joint of S. And here you see this is the another joint in between the occipital bone and the atlas, and this is called joint of no. Joint of no, and this is the movement of no, and this is the movement of yes. Okay, because these are all the joints underlie the suboccipital region. Next, you see here, this is the occipital bone, and this is real bone. This is the external occipital protuberance, and this is the superior nuchal line. This is the highest nuchal line, and here this is the inferior nuchal line. And here you can see this is the occipital crest, external occipital crest, and here this is the atlas. This is the axis. These are the bones you see, and here this is one is the posterior atlanto-occipital membrane. In between the posterior margin of the foramen magnum and the upper border of the posterior arch of the atlas, there is a membrane. This is called posterior atlanto-occipital membrane, and in between the axis and atlas also there is a small membrane. This is called ligamentum flavum. Okay, these are all the bones and ligaments which are present forming the floor of the suboccipital triangle or suboccipital region. Next, first you see what is the suboccipital region. What is the extent of the suboccipital region? That is important. And next, here the suboccipital region is limited above by the inferior nuchal line and below by the transverse or bifid spine and the lamina of the axis. Bifid spine and lamina of the axis, and laterally by the mastoid process and transverse process of the atlas and axis. Here you see this is the inferior nuchal line. This is the upper extremity of the suboccipital triangle, and below by the this one. Okay, below here you see this is the axis and this is the atlas, and on both sides here and this side and that side there is a one bone, that is the mastoid process, and this is the transverse process of the atlas and axis. So from here to here, and this side also same, from here to here, and this is the area of the suboccipital region. Next, coming to the, here you can see here, these are the muscles of the suboccipital. These are all the muscles, important muscles of the suboccipital region. And here this is the, these two are the triangles, the suboccipital triangles. They are nothing but the small triangles on both sides of the midline of the suboccipital region. And this is the one triangle, and here this is the another triangle. Next, these are a pair of muscular triangles situated on each side of the midline in the suboccipital region. And what are the boundaries of the suboccipital triangle? That is very, very important. You see, this is the a triangular area, and here it is having three borders, that is superomedially, this is the superolaterally, and this is the inferiorly. Here you see, this is the superomedial border. It is formed by a muscle, that is rectus capitis posterior major. Rectus means straight, capitis means related to the head, and posterior, it is in the posterior part, and major means big muscle. Here this is the rectus capitis posterior minor. Okay, this is the muscle. It is forming superomedial boundary of the suboccipital triangle. Okay, this is the muscle. And here this muscle, it is taking origin from the bifid spine of the axis, and it is going upwards and laterally and backwards, and it is inserted to the occipital bone below the line, that is the inferior nuchal line, below the inferior nuchal line and below the inferior nuchal line. Okay, this is the muscle, that is the rectus capitis posterior major muscle. It is forming medial, superomedial boundary to the suboccipital triangle. Next, coming to the another boundary, this is the superolateral boundary. Okay, superolateral boundary. Here, this is superolateral boundary. It is formed by another muscle, that is called obliquus capitis superior. Obliquus capitis superior. Why it is called obliquus? It is obliquely oriented and is related to the head, and it is forming the superior boundary. That is why superolaterally. That is why it is called obliquus capitis superior, and this is forming the superolateral boundary of the or suboccipital triangle. Okay, these are the two boundaries. Next, coming to the inferiorly, and here the superolateral boundary, it is formed by obliquus capitis superior. Here, this muscle, it takes origin from the transverse process of the atlas. Transverse process of the atlas. The atlas is nothing but the first cervical vertebra, and it extends and it goes backwards and medially, and it is inserted the line, the area below the superior that is a superior nuchal line, or in between the nuchal line, superior nuchal line and the inferior nuchal line. That area is providing insertion to the obliquus capitis superior. And next, coming to the another muscle, inferior boundary, it is formed by obliquus capitis inferior. Okay, here this muscle, it is a small muscle, and it takes origin from the bifid spine of the axis, and it goes and it gets inserted to the transverse process of the atlas. Okay, here this is the small muscle. Why it is called obliquus capitis inferior? That is in the, it is forming the inferior boundary to the, that is our triangle, that is suboccipital triangle, and it is obliquely oriented and it is related to the head. That is why it is called obliquus capitis inferior. Okay, these are all the three muscles they are taking part. And here superomedially, it is also supported by another muscle, that is small muscle, that is the rectus capitis posterior minor. Okay, and these are the three boundaries. Next, what are the structures forming the roof of the suboccipital triangle? Okay, these are the boundaries. You can see superomedially by the rectus capitis posterior major, and superolaterally by the obliquus capitis superior, and inferiorly by the obliquus capitis inferior. These are the muscles. Next, coming to the roof. The roof is formed by, and in the roof, suppose if you go from surface to deep, that is first skin, below that there are muscles and dense connective tissue, and afterwards there are muscles. That is the two. There are two muscles that are taking part in the formation of the roof of the suboccipital triangle. That is the first one is the semi-spinal semispinalis capitis and medially by the longissimus capitis. These are the two muscles. Here the semispinalis capitis medially and longissimus capitis laterally. There is a, you see here, this is the semispinalis capitis. This muscle goes like this and it is forming the medial part of the roof of the triangle, and here this is the longissimus capitis, and here it is forming the lateral part of the roof of the triangle. Okay, next, within the roof, there are some important structures, that is especially the greater occipital nerve and the occipital artery are related with the roof because they are passing through the roof. That is greater occipital nerve and occipital artery. You see, this is the greater occipital nerve and this is the occipital artery. Here, the greater occipital nerve, it is related with the triangle, that is inferomedially. Inferomedially, it is related with the triangle, and here it encircles the lower border of the obliquous inferior muscle, capitis inferior muscle, and then it passes the roof of the suboccipital triangle. Then it enters into the back of the neck, the back of the neck. Finally, it enters into the back of the skull and it supplies to the scalp. And here you see, this is the occipital artery. Here, this is the branch from the external carotid artery at the level of the, that is the facial artery, and it comes out from the neck into the suboccipital region by passing the groove on the mastoid process. Here then it comes, and here this artery, it is related with the suboccipital triangle, roof of the suboccipital triangle in the superolateral part, superolateral part, and artery nerve is in the inferomedial part. Okay, these are the two structures, they are present in the roof of the suboccipital triangle. Okay, next, contents. What are the contents of the suboccipital triangle? This is also very, very important. Here, this is the first one is the third part of the vertebral artery and first cervical nerve. This is also called suboccipital nerve because it is in the suboccipital triangle. That is why it is also called suboccipital nerve. And next is the suboccipital plexus of veins. Suboccipital plexus of veins. Okay, these are all the three important contents. They are present in the suboccipital triangle. First one is the vertebral artery, especially the third part of the vertebral artery, and next is the first cervical nerve, that is this is also called suboccipital nerve, and suboccipital plexus of veins. These are all the three contents of the, that is suboccipital triangle. Next, coming to the floor. What are the structures taking part in the formation of the floor of the suboccipital triangle? That is, the suboccipital triangle floor is formed by posterior arch of the atlas and the posterior atlanto-occipital membrane. Posterior atlanto-occipital membrane. Okay, you see here, these are the contents. Here, this is the third part of the vertebral artery, and this is the first cervical nerve, and this is also called suboccipital nerve. And next is the, this is the posterior atlanto-occipital membrane. Posterior atlanto-occipital membrane. It extends from the lower margin of the foramina magnum to up to the upper border of the atlas. Here, this is the fascia, and this is the posterior atlanto-occipital membrane. And these are the two structures that are taking part in the formation of the posterior or roof of floor of the suboccipital triangle. You see here, this is the arch of the atlas, and this is the posterior atlanto-occipital membrane. Here, this side like this, here there is a one triangle, and here like this there is one triangle, and here also there is another triangle, and here this is the floor of the suboccipital triangle. Okay, that is the arch of the post atlas and the atlanto-occipital membrane. Next, coming to the contents in detail. We discuss contents in detail. What are the contents? You see here, this is the third part of the vertebral artery. Third part of the vertebral artery. And here, see, first you see about the vertebral artery. What is vertebral artery? What are the different parts of the vertebral artery? First, you see the vertebral artery, it arises at the neck of the neck, and then it ascends. It goes upwards and here actually it is a branch from the first part of the subclavian artery, first part of the subclavian artery, then it ascends and finally it reaches up to the level of the sixth transverse process of the cervical vertebra. That is the sixth transverse cervical vertebra transverse process. All the transverse process of the cervical vertebra, they contain a special structure that is called foramina transversarium. Foramina transversarium, that is the specially uh, produced foramen for the passage of the vertebral artery. For the passage of the vertebral artery, and here the first part it is in between the subclavian artery and the up to the level of the sixth transverse process of the cervical vertebra. And next is the second part. The second part of the artery is within the transverse process of the cervical vertebra. Okay, you see, this is the subclavian artery, and here this is the first part. From here to here, this is the first part of the vertebral artery. Here, the one point you remember, it is not passing through the foramina transversarium of the C7. C7, it is passing through the foramina transversarium of the C6, C5, C4, C3, C2, and C1. Okay, and this part of the vertebral artery, you call it as second part of the vertebral artery. Okay, then finally, the foramina transversarium of the first cervical vertebra, that is the atlas, the vertebral artery comes out and it forms here a bend, here a bend loop, and this loop is important for the damping of the damp. It acts like a dam, and it reduces the, or it slows down, or it regulates the blood flow to the brain, especially here you see this is the one side vertebral artery, this is another side vertebral artery, and together they form the basilar artery. This basilar artery is very, very important for the blood supply to the upper part of the spinal cord, brain stem, cerebellum, and postero-inferior part of the cerebrum. Okay, these are all the parts which are supplied by the basilar artery. Here, this part is called third part of the vertebral artery. Okay, third part of the vertebral artery, and here you can see this is the this is the third part of the vertebral artery. Here, this third part of the vertebral artery, after piercing the atlanto-occipital membrane, then dura, then arachnoid, and finally it enters into the cranial cavity. And both sides of these vertebral arteries, this side and this together, they form the inside the cranial cavity. They form the in front of the pons. They form the basilar artery, and then it supplies to the different parts of the brain. Okay, this is the third part of the vertebral artery. Here, yet this is the this is the part of the vertebral artery which lies within the or suboccipital triangle. Okay, this is the here at the area of piercing of this vertebral artery, that is this atlanto-occipital membrane. Sometimes it may get ossified. That means it is replaced by bone, and in that occasion it may produce compression over this artery while different movements of the head, and it may produce giddiness and that is vertigo. That is one of the most common cause for the vertigo, that is compression over the vertebral arteries. Because this is the artery main source of blood to the brainstem and the cerebellum. Because of this reason, it may produce vertigo. Next, another content is first cervical nerve. The first cervical nerve, it is also known as suboccipital nerve. And the suboccipital nerve is also very, very important. While passing behind the lateral mass of the atlas, it divides into two parts, that is the dorsal and ventral rami. And here you can see here, this is the nothing but the dorsal rami of the first cervical nerve, and here it divides into five branches, and it supplies to the muscles of the suboccipital triangle, that is the rectus capitis superior, rectus capitis, obliquus capitis, rectus capitis posterior major and minor, and inferior, and here another muscle, that is splenius capitis. These are all the 5 muscles. They are all supplied by the posterior rami of the suboccipital nerve. Okay, then another branch, that is ventral rami. Ventral rami, it passes in front, and then here it joins with the another branch from the, here you see, this is the first cervical nerve. Here this is the dorsal ramus, this is the ventral ramus. The dorsal ramus goes back, and it is entering into the, that is the suboccipital triangle, and it is applying to the muscles of forming the suboccipital triangle. And this is the ventral ramus. Ventral ramus, it goes in back and lateral to the lateral mass of the atlas, and finally it joins with the, and again it divides into two, that is the upper branch and lower branch. Here it joins with the hypoglossal nerve, that is and here it also gives, that is the branches to the 5 muscles, that is omohyoid, thyroid, and geniohyoid. Apart from this, there are 2 muscles, that is just like our rectus capitis posterior major and minor. Here there is a rectus capitis lateralis and rectus capitis anterior. This total 5 muscles, they are supplied by the ventral ramus. So the first cervical nerve, in general, it is supplying to the 10 muscles. That is ventral ramus supplying to the 5 muscles, and dorsal ramus also supplying to the 5 muscles. Okay, that is the importance of the suboccipital nerve. Next content is the suboccipital venous flexus. Suboccipital venous flexus. This suboccipital venous flexus, it is present in the suboccipital triangle, and it collects blood from the neighboring muscles first, and occipital veins, and transverse sinus, internal vertebral venous flexus, and finally the blood is drained into the vertebral venous flexus. Okay, here next is another important thing, the relations of the suboccipital triangle. That is the most of important structures which are related to the suboccipital triangle is that is greater occipital nerve, third occipital nerve, and occipital artery. First, you see what is the greater occipital nerve. It is the thickest cutaneous nerve of the body. That is the specialty of the greater occipital nerve. That is the thickest cutaneous nerve of the body, and is derived from the medial branch of the dorsal ramus of the C2. Medial branch of the dorsal ramus of the C2. And another one is the third occipital nerve. This is the, it is also a very important branch, that is medial branch of the dorsal ramus of the C3 nerve. Pierces the semispinalis capitis and trapezius, and finally it ascends in the back of the neck, and it supplies to the, and just lateral to the external occipital protuberance and the greater occipital nerve, it supplies to the scalp. Next is occipital artery. Here it arises from the external carotid artery opposite the origin of the facial artery in the carotid triangle. In the occipital region, it gives off 4 branches. That is the meningeal branch, it supplies to the meninges of the brain, and mastoid branch, it goes to the mastoid process, and muscular branches, it supplies to the surrounding muscles, and then descending branches. Here, the descending branch, again, it divides into 2. That is, one is superficial, another one is the deep. And these superficial and deep branches, they anastomose with the corresponding branches of the transverse cervical artery and superficial cervical artery. Okay, and here it is anastomosing with these 2 arteries. And here, whenever there is obstruction to the carotid arteries or the external carotid artery, it acts like a bypass channel between the 2 arteries, that is subclavian artery and some parts of the carotid arteries. Okay, that is why these are also very important. Next, coming to the another important topic here, that is what is the, why you supposed to know about the suboccipital triangle. This is also very, very important, because this is the most common site for the pain, that is the neck rigidity. The spasm of the extensor muscles of the neck, they may produce here, because these muscles of the this neck, that is 4 muscles, that is already you know, that is the rectus capitis posterior major. Okay, see, rectus capitis posterior major, and obliquus capitis superior, obliquus capitis inferior, and minor. These are the four muscles. They are very important for the different movements of the neck. Different movements of the neck. Suppose if you take, this is the muscle, this is inferior, obliquus inferior. It produces the tilt, lateral tilt of the neck. And if you take the this superior and rectus capitis superior, there is capitis major and superior, obliquus capitis superior. These muscles are helpful for the extension of the neck. Okay, on both sides of this muscles, they produce extension. Like that, these are all the muscles that are responsible for the different movements of the neck. Whenever there is irritation to these nerves, that is, which are supplying to the muscles, they may produce neck rigidity or pain. Or at the same time, these are also supplying to the meninges. That is why there may be irritation of these nerves. It may produce the neck rigidity or neck pain. That is one important thing. Next, coming to the another clinical, most important clinical thing, that is a cisternal puncture. Cisternal puncture. First, you're supposed to know what is cisterna. What is cistern? Okay, here within the central nervous system, there are some dilated areas between the nervous tissue and the meninges. There are some dilated areas. They are called cisterns. They are called cisterns. Here, already you know that is the lumbar puncture. Lumbar puncture, that is nothing but the introducing the needle into the that is subarachnoid space for the aspiration of cerebrospinal fluid. That is at the disc between the L3, L4 or L2, L3. That is the routine procedure. And suppose if you see in some individuals, that is not possible because there is maybe degenerative changes in the vertebrae, and you are unable to pass the needle into the subarachnoid space in the lumbar areas. In that occasions, we go for cisternal puncture. Cisternal puncture. This is just like lumbar puncture. This is also another procedure. Here, the most important thing of the cisternal puncture is, if you want to do cisternal puncture, you must have an idea about the what is cistern, what is the depth of the cistern. That is very, very important. Because if you see here, you see this is the cranial cavity, and here this is the anterior arch. This is the posterior arch of the atlas. This is the axis. Okay, this is the dens. And in between the posterior arch of the atlas and the posterior margin of the foramina magnum, there is one membrane. This is called posterior atlanto-occipital membrane. Posterior atlanto-occipital membrane. And here, this is the area we are introducing needle into the cistern. Here, this is the exact location for the cisterna magna. Why it is called magna? That is biggest cistern of the entire cisterns which are present in the CNS. Here, this is the cisterna magna, and this is also called pontomedullary cistern. Cerebello-medullary cistern. Cerebello-medullary cistern. This is the cerebellum. This is the medulla, and this is the cerebello-medullary cistern. If you want to introduce needle, first you have to shave the patient total head, and then you have to take proper sterile precautions, because this is directly you are entering into the central nervous system. Central nervous system. Because of this reason, you must be very careful before doing the cisternal puncture. At the same time, here you must have an idea about the up to which length is supposed to go into the body. That is also very, very important. Otherwise, because very closely related to this posterior atlanto-occipital membrane, here if you go for 4 to 5 centimeters, 4 to 5 centimeters, and below that, here there is a you up to that level you feel resistance. Immediately after entering into the system, there is a resistance free. The needle goes resistance free into the system. Then you have to stop immediately. Otherwise, if you further extend the needle, it may cause damage to the medulla, because this is the vital area, because it contains the vital centers of the respiration and heart. The patient may die on table if you introduce the needle without resisting to the cistern. That is why this procedure is very, very important. It needs expertization. Okay, that is the here. This is the posterior atlanto-occipital membrane. Here you are piercing the posterior atlanto-occipital membrane in the midline. Actually, we are piercing the this membrane in the midline just above the spine of the axis atlas, just above the, you see here, this is the posterior atlanto-occipital membrane. If you go sides, it may cause damage to the vertebral arteries, and venous plexus is also there. Okay, that is why if you cause damage to this one, it may produce subarachnoid hemorrhage inside the cranial cavity. That is why while doing cysternal puncture, you must be very careful. Here, this is the posterior tubercle of the atlas, just above the posterior tubercle of the atlas, and here this is the site for the cysternal puncture. Here, the direction of the needle is also very, very important. You have to introduce the needle in this direction, that is external occipital, external orbital opening to the external acoustic meatus towards the nasion. That means you have to put the needle like this, in this not the straight direction. You have to put the needle like this, that is from external ear to the nasion. This is the part is called nasion, and you have to direct the needle to enter into the cisterna magna. Okay, that is the importance of the cisterna magna and cisternal puncture. Okay, you must be very careful while doing the cisternal puncture, because if you cause damage to the medulla, it leads to death of the patient. That is why this cisternal puncture is also very, very important. Next is the another important thing, clinical aspect related to this one, is the surgeon's approach from the posterior cranial fossa through this region. Okay, if they want to go into the posterior cranial fossa, especially that is the so infratentorial compartment, because suppose if there is that is cerebellar tumors or any clotting in this posterior cranial fossa, the surgeon approaches this posterior cranial fossa through the suboccipital triangle. Okay, because of all these reasons, the suboccipital triangle is very, very important. You must have an idea about the suboccipital triangle. Okay, and another most important difference here between the spinal nerves of the that is C1 and C2 and remaining spinal nerves, that is, you see, you observe here, this is the superior articular facet of the C1, and this is the superior articular facet of the typical cervical vertebra. Okay, here you see, this is the nerve. It is passing in front of the superior articular facet, but here it is passing behind the superior articular facet. Why? Because in the atlas and axis there is no body, there is no vertebral body, but here there is a vertebral body. Usually in between the vertebral bodies and of the two adjacent typical cervical vertebra, there are three joints. That is, first in the middle there is a secondary cartilaginous joint, and here there is a ankle joint, and here on both sides. Here, because there is no body, and this ankle joints and the superior articular facets together, they fuse and they form the superior articular facet. Here you see, this is the ankle facet, and here the nerve is passing behind the ankle facet, but in front of the superior articular facet. But because here this superior articular facet is merged with the ankle facet in the first and second cervical vertebra, because of this reason, the first and second cervical nerves, they are passing behind the superior articular facet. Okay, and here over this superior articular, here at this area, this is also related with the third part of the vertebral artery. Here again, this third part of the vertebral artery is also very, very important in the suboccipital triangle, because here you see, this is the suboccipital triangle area. This is the third part of the vertebral artery. Here, this is the axis. This is the atlas. Here it is going laterally and upwards, and here also there is one bend. Because this bend, it protects the vertebral artery from stretching, because during this like these movements, during like these movements are stretching like this, there is a chances for the flexion, the stretching of this artery. Because of this reason, there is a one bend, it protects the artery from stretching. Okay, this is also another important point you must remember. Okay, these are all the things which are related with the suboccipital triangle. Okay, finally, what is suboccipital triangle? That is, it is a muscular, these are muscular triangles on both sides of the midline situated in the suboccipital region. What are the boundaries? That is muscles, that is superior medially by the obliquus rectus capitis posterior major, and superior laterally by the obliquus capitis superior, and inferiorly by the obliquus capitis inferior. These are the boundaries of the suboccipital triangle. And next, coming to the roof, that is formed by the skin superficial fascia, then below that there are muscles, that is superior, that is medially by the semispinalis capitis and laterally by the longissimus capitis. And within the roof there are through two important structures, that is one is the occipital artery, that is the that is superior laterally, and superior inferior medially, it is also related with the occipital now, greater occipital now. Okay, these are the roof. Next, coming to the contents, that is the third part of the vertebral artery. And that is next is the first cervical nerve, this is also called suboccipital nerve, and vertebral plexus of, that is a venous plexus. Here the venous plexus of this area is also having related with the vertebral venous plexus. Okay, okay, here this suboccipital venous plexus is related with the vertebral venous plexus. Because of this reason, if there is any infection or any malignant conditions of the neck, they may be transmitted towards the vertebral venous plexus, and it may go migrate, or this may, that is what we call metastase to the central nervous system. Okay, here you, if you take the vertical section of this one, here this is the posterior atlanto-occipital membrane. During cysternal puncture, you are introducing like this, and here this is the site for the medulla. That is why you must be very careful. Okay, that is the next floor. It is formed by the posterior atlanto-occipital membrane and the arch of the posterior arch of the atlas. Okay, these are all the important points related with the suboccipital triangle and suboccipital region. Okay, thank you.